come to via page in the Senate. If you would please come to the microphone and tell us your name, your hometown, and your senator who is sponsoring you this week, please.
Good morning. My name is Ada Saki. I'm from Mooresville, and my sponsor is Senator Sawyer.
My name is Kate Taylor. I'm from Wake Forest, and my sponsor is Senator Everett.
My name is Gina Bion. I'm from Oak Ridge, and my sponsor is Senator Berger.
Good morning. My name is Reese Stevens. I'm from Raleigh, North Carolina, and my sponsor is Senator Adcock.
Good morning. My name is Christopher Pager. I'm from Morganton, North Carolina, and my sponsor is Senator Paul Lowe.
Good morning. My name is Jackson Kasaya. I'm from Wake Forest, and my sponsor is Senator Everett.
Well, we're so happy that y'all are here, and I hope that you have an interesting week and learn some things and have a good report back when you go back to school next week. So we have a busy calendar today. I've been asked to remind everybody that there's judiciary is in here the hour after us, and so we're going to maintain a tight schedule and roll on and get our work done so that the judiciary can start. They have a huge calendar. So first bill on our calendar is Senate Bill 405, chiropractic modifications. And Senator Heiss is to present. And I believe, Senator Heiss, you have amendments. Do you want to do amendments first?
I do. I have one amendment.
Okay.
S405 ABC 28.
Okay.
This is just a move to amend the bill, and it's just a technical amendment that changes from 2025, but says 2025 and applies to applicants and licensure before or after that date. It was a technical clarification.
Super. Are there any questions on this technical amendment? If not, all those in favor of the amendment, please say aye.
Aye.
Anyone opposed? Motion carries. So, Senator Heiss.
Thank you, Madam Chairman. The bill you have before you, chiropractic modifications, were proposed by the Chiropractic Board to modernize their statutes related to training and align with current practices. It updates the references of chiropractic colleges to programs because they're likely, instead of being standalone colleges, more likely to be programs at a larger school. Adds a certification for acupuncture to align with the current chiropractic scope of practice since they're exempt from the acupuncture statute. Allows recognition of international training programs, removes outdated credit hour requirements because they use competency-based standards now. Expand the board's best practice authority to imaging instead of the more narrow radiology, and clarifies that chiropractors cannot prescribe any medicines that require a prescription for FDA regulations. For example, a chiropractor couldn't say go home and take Tylenol. That's because that's an over-the-counter medication that was considered prescribing, but this allows that outside of something that's FDA required for a prescription. That's all I have, Madam Chair.
Thank you. Any questions or comments or concerns about the bill? Senator Adcock.
Thank you so much, Madam Chair, and thank you, Senator Heiss. I have heard from many acupuncturists in my district, and including my own acupuncturist, not pushing back so much about chiropractors doing acupuncture, but interested in having it clarified in the bill, if possible, that chiropractors will be held to the same standard performing acupuncture as acupuncturists are. Could you speak to that or ask someone else to and try to allay some of those concerns?
Senator Heiss?
It's only diving into this issue. The first I kind of got into with the conversation with acupuncture is actually about 5 minutes before the meeting started. That's becoming it. But I will say that there was the intent of the General Assembly to not put the chiropractors under the standards under the Acupuncture Act that's coming in. So we're having conversations. I've asked the board to review the potential amendment that was there as well. But I think they're very different entities and practices, and we're trying to figure out if one sets the standard and the other follows, or those type of things. But I'll see what I get back on that response as we move forward.
Follow up?
I really appreciate that, because I think the intent is that since both boards are responsible for public protection, is to make sure that people know what they're getting and they're getting the same standard of care. So I really appreciate that.
Other questions from the committee? If not, we're going to go to public comments. We have quite a few speakers signed up for this bill. The first one is Rose Mulhern.
Good morning. My name is Dr. Rose Mulhern. I'm a licensed acupuncturist, and I'm the legislative chair of the North Carolina Society of Acupuncture and Asian Medicine. I'm speaking today to ask you to vote no on this Bill 405 on behalf of my board and the 1,000 patients that signed a petition in the last few days in opposition to this bill. So this bill in Section 2 seeks to establish certification standards for the practice of acupuncture by doctors of chiropractic. These certification standards have already been established by Senate Bill 422 in 1993, which gave legislative authority to the North Carolina Acupuncture Licensing Board to regulate the practice of acupuncture. Allowing a separate profession to unilaterally define acupuncture standards undermines regulatory safeguards. It creates confusion for patients and puts patient safety at risk. Studies have shown that when acupuncture is performed by properly trained acupuncturists, the risk of adverse events is low. Acupuncture is considered generally safe by the FDA. This is due to extensive education and training. Acupuncturists like myself are required to have a 3-year master's or a 4-year doctorate degree, 3,000 or more hours of education, a clean needle technique course, and a 4-part national exam. Chiropractors, in contrast, have 200 hours of training. Whom would you trust to needle yourself or your child or another family member? When regulatory bodies lower educational standards or bypass oversight from established acupuncture boards, it not only compromises the safety and quality of care, but also undermines public trust in acupuncture as a licensed and evidence-informed profession. So we're asking that you vote no on this bill in order to allow an established regulatory board to regulate its own specialty. Acupuncture should regulate acupuncture. Thank you.
Next speaker, Jeannie Norfleet.
Good morning, esteemed legislators. My name is Junie Norfleet, and I'm a lifelong resident of North Carolina. I'd like to share with you what I was doing in 1992 and 93. In 1993, North Carolina legislature created the North Carolina Acupuncture Licensing Board. At that time, I was an office manager of one of the very few acupuncturists in our state. My employer was appointed to the first acupuncture board, and I became the rules reviewer for North Carolina board and was blessed to work directly with Molly Macy. At this point in time, acupuncturists earned a master's degree. During this time, the North Carolina Acupuncture Board wanted to allow their practitioners to use acupuncture needles. The Chiropractic Board requested that they be exempted from supervision by the North Carolina Acupuncture Licensing Board, and they agreed to require chiropractors to have 200 hours of education in acupuncture. Since 1993, 2 schools of acupuncture have been established in North Carolina, one in Boone and one in Asheville. Both are nationally accredited, and one is licensed by the North Carolina Board of Governors to convey a doctoral degree. I am requesting that you consider the impact of lowering standards for any healthcare profession. This will not serve the citizens of North Carolina. I appreciate all that you do, and thank you for this time.
Thank you, ma'am, for coming today. Lisa Udeman. Maybe you just sell that.
Hello, I'm Dr. Alyssa Judeman. Good morning.
Okay, great.
I am the chair of the North Carolina Acupuncture Licensing Board, tasked with overseeing safety for all patients receiving acupuncture in North Carolina. I am also the clinical director at Taoist Traditions College of Chinese Medical Art in Asheville, North Carolina, also tasked with overseeing patient safety. It's of utmost importance. I received my bachelor's degree from University of North Carolina in Asheville, and then went on to gain 2,025 more hours of education in acupuncture and Chinese medicine to get my master's degree, and then 750 more hours to get a doctorate. And the state of North Carolina licensed acupuncturists must attend such a program of a 2,000-hour minimum of training with a lot of focus on safety, and it has to be from a nationally accredited school. It also required to do an internship, like the one that our program is 2 years, and in those 2 years, every single acupuncture point is checked by a licensed acupuncturist before it is inserted in the patient and after, again, ensuring safety. Licensed acupuncturists in North Carolina have to pass acupuncture-specific board exam, as well as a biomedical-specific board exam, ensuring complete understanding of underlying anatomy, such as nerves, vessels, and organs, to be able to needle safely, as well as a clean needle technique course, ensuring that they know how to handle needles properly to minimize the risk of disease transmission. And then to maintain a license in North Carolina, you have to get 40 years of continuing education every 2 years. We take education and safety very seriously, and we encourage our state to do as well. Thank you.
Ben Townsend.
Good morning. My name is Ben Townsend. I have served for about 4 years on the Standards and Licensing Committee of the North Carolina Acupuncture Licensing Board. As Alyssa was just saying, in order to attain licensure, after receiving a master's or doctorate in acupuncture and completing 2 years of closely supervised clinical internship, graduates must pass 3 national exams, and for every 2 years thereafter, they must receive the 15 hours specifically in acupuncture, plus an additional 25 years in acupuncture-related skills. The reason we have such stringent requirements for licensure of acupuncturists is because that the title indicates that we are qualified to insert needles of varying lengths into any of about 800 points on the body. Many of these points are located in areas where vital organs are mere centimeters beneath the surface. In order to perform the procedure safely, we are trained extensively in angle and depth of insertion. If someone inserts a needle improperly into any of several points near the sternum, they could puncture the heart or aorta. If a needle is inserted improperly into any of the few points in the back of the neck or any of the points around the neck, they could damage the spinal cord or artery. Some of the most commonly used points are separated by about 2 centimeters of flesh before the needle could penetrate the lung. Thorough knowledge of needle depth is not only necessary to prevent both bodily harm, but also necessary to attain therapeutic result. There's a point that I routinely use in which I must insert a needle an inch or more into the eye socket. I do this confident in my ability to attain a therapeutic result without damaging any injury because I have received extensive training. I routinely insert 6 to 7 inch needles into larger patients in order to reach beneath the fatty layer. If I were inadequately trained, I could run the risk of either penetrating too deeply or causing harm, or not penetrating deeply enough to achieve therapeutic benefit, and therefore not performing the service I'm billing for. Inserting needles into flesh can be done with minimal training, but performing acupuncture requires extensive knowledge of point location as well as needle depth and angle. It is responsibility of the Acupuncture Licensing Board to protect the public from both risk of harm from acupuncture therapy, as well as from fraudulent claims of providing acupuncture therapy without proper training of the procedure. If chiropractors are going to practice acupuncture, their education requirements need to be adequate and clearly defined in order to protect the public. Thank you for their time. your time.
Mike Tadych, Tadych.
Good morning, and no one has ever gotten that right. My name is Mike Toddy, and it's a privilege to be with you this morning. I serve as the board attorney for the Acupuncture Licensing Board, and also serve as its rulemaking coordinator with the Office of Administrative Hearings. As you've sort of heard, in 1993, the General Assembly defined acupuncture as a form of healthcare developed from traditional and modern Chinese medical concepts that employ acupuncture diagnosis and treatment and adjunctive therapies and diagnostic techniques for the promotion, maintenance, and restoration of health and the prevention of disease. That's in 90-451, parens 1. At the same time, the General Assembly defined the practice of acupuncture as the insertion of acupuncture needles and the application of moxibustion to specific areas of the human body based upon acupuncture diagnosis as the primary mode of therapy. Adjunctive therapies within the scope of acupuncture may include massage, mechanical, thermal, electrical, and electromagnetic treatment, and the recommendation of herbs, dietary guidelines, and therapeutic exercise. By and large, the General Assembly charged the NCALB with the regulation of acupuncture to promote the health and safety of people in North Carolina. There were 3 exemptions to that requirement, and those were a physician licensed under Chapter 90, a student learning to practice on acupuncture supervised by an acupuncturist, and a chiropractor licensed also under Chapter 90. Ms. Norfleet, as you've heard, explained how that exemption came about. When you consider the proposal before you, I ask that you look at the definition of chiropractic under 90-143A and look at the requirements of competency through examination under 90-143B3. I believe you will note the practice in science and healthcare of acupuncture is not among those areas listed. At a minimum, for the health and safety of the people of North Carolina, I urge you to set a floor of 200 additional hours of training and demonstrated competency for chiropractors to practice what the General Assembly defines as acupuncture. Alternatively, I suggest you consider eliminating the exemption from licensure found in our general statute to ensure that the people of North Carolina will not be confused that the insertion of needles into people by chiropractors is the practice of acupuncture, as it does not meet this body's statutory definition. Thank you.
Leanne Thomason.
Good morning, Senators, and thank you for seeing us today. My name is Leanne Thomason. I'm a licensed acupuncturist, and I've been practicing for over 20 years. One of the things that people have said to me is, why are you so interested in this bill? I'm interested in opposing Bill 405, primarily because it's not enough. I see that this bill has a lot of detail around the laws and practices of chiropractic. They're really detailing line by line. They're changing the words and all of that. But the acupuncture has one line: establish certification standards for the practice of acupuncture by the doctors of chiropractic. And what else? I don't know what this entails, and I need to know, because as an acupuncturist, this does apply to me. I may not be a chiropractor, but anyone who does acupuncture creates a precedent for the public. People don't know how to distinguish between a chiropractor doing acupuncture and an acupuncturist doing acupuncture. It really all gels together. And so when patients come into me, and they have in quite a few numbers, telling me that they've received injury from chiropractic acupuncture, that gives me a real concern for public safety. That is my primary reason that I'm here before you today. I just had a neighbor yesterday tell me my mom was injured getting acupuncture from a chiropractor. Now, I'm not saying that this is not under the purview of chiropractic. Mostly what I need more details. I'm not going to give you carte blanche, this one line telling me, yeah, go ahead, chiropractic board, set the standards. But you've had this ability for decades, and to what end? I've seen no changes. I don't see any regulations from the chiropractic world. The requirement is supposed to be 200 hours per our history. What I don't see that happening, and I also heard from the chiropractic board that they're struggling to get those 200 hours of training for chiropractors to receive training in acupuncture. That is specifically what I've heard from the chiropractic board. The chiropractic board has also, in their agenda meeting minutes, shown chiropractors, some of them struggling to even pass their chiropractic licensure exams. So if I'm seeing them struggling with their current standards for chiropractic, what training are they getting? And at what scope are they getting the training for acupuncture? And who's going to help them make those standards? Do chiropractors know the rules? Do they know the depth of the needle? The acupuncture board is exactly established for those exact things. We've spent many hours. We can make this happen. We're here to support public safety and to preserve the patient's access to health care that makes a difference with really no risk. And that's what I want to protect. And I also want to just thank you, each of you, for your time here and listening deeply to this. Thank you so much.
Renee Ramsey.
Good morning. My name is Renee Ramsey, and I'm actually a retired acupuncturist. I began practice here in the Triangle area in 2003, long before there were any number of acupuncturists here. Back at that time, I had to work diligently and put myself in front of thousands and thousands of people in order to teach people how safe and how effective acupuncture was for our community. And that has grown and built and built. And back then there were only a few of us practicing, but we built that reputation of safety and efficacy year after year after year, to now the point that we have a phenomenal community of acupuncturists, and we actually still need more acupuncturists. So if chiropractors want to get trained in acupuncture, we welcome that. There aren't enough acupuncturists to treat the number of people that need to get treated here in the community, but they need to get trained. And 200 hours, there is not a chance that 200 hours is even enough to truly be trained in acupuncture and Chinese medicine. We had over 3,000 hours of training, and that was just the beginning. Then internship, and then practice. So I welcome chiropractors to be trained in acupuncture. We would love that, and we would love to share this medicine with as many people as we can. But let's do that safely and keep our community health at the priority. Thanks so much.
Dr. Siragusa, Siragusa.
You did very well, thank you. I am Dr. Joe Siragusa. I'm the Executive Director for the North Carolina Board of Chiropractic Examiners. I speak on behalf of and in favor of Senate Bill 405. I certainly appreciate the comments of our acupuncture colleagues. I think there's some misunderstanding about what we're trying to do and how we're trying to do it. The chiropractic profession includes the practice of acupuncture. It's taught in chiropractic schools. This is not an issue of scope. This is not an issue of turf. This is an issue of regulation. We have had, as you've heard, we have had a rule for regulating chiropractic acupuncture. Recently, there appears to have been a regime change in the lawyers at the Rules Review Commission. And when we tried to make an edit to our existing rule to address changes in the way education is being delivered, we were told you can't edit your rule because you don't have specific statutory authority to make rules about acupuncture. Hence, this 405, this line about being able to make regulations governing acupuncture so that we can go back to our rule in the regular rules making process and adapt and edit our current rule. Again, we are exempt from the Acupuncture Practice Act. Our doctors get a 4-year physician level degree, and then we require, in addition to that, 200 hours of specific acupuncture training. The acupuncturist 3,000 hours is includes all their basic science, anatomy, etc., I assume. So the 200 hours is not compared to 3,000. It's our 4-year degree plus 200 hours compared to their 3,000. So again, it's an issue of public safety. I've been in this position for 5 years. We have not had a single complaint about acupuncture causing injury by a chiropractor or otherwise. We are continually upgrading our standards. There's no diminution of our standards. We've recently required a national exam for chiropractors to practice acupuncture. So we as a licensing board are asking for your help to get statutory authority to pass a rule so we can regulate acupuncture performed by chiropractors, which I think is what I heard the acupuncturists asking for as well. So I appreciate your consideration.
So committee, based on, we have a dwindling time, please remind you all that we have to clear out for judiciary. We have 2 bills left to consider. Senator Lee has made a motion. Does anybody have anything that they feel like they have to say before we go ahead and vote?
Sorry.
Senator Mayfield.
Thank you. I did have some questions, but I'll hold those. But given, in light of what the last speaker said, I'm not hearing that the chiropractors necessarily want to change the standards that exist now, and maybe even that they have increased them. So I wonder if it would be an option to change the bill to, sort of maybe include some language that says, they have the ability to create standards that are no less stringent than those currently in place, and those could be listed, and so then they could, they could change them. We don't want to lock them in, but they could change them, but they would only be able to change them in the upwards direction, not, because that's what I've heard from my folks, is the concern about lowering standards, which I don't know that any of us want to do. Thank you.
Madam Chair.
Senator Heist.
Thank you, Madam Chairman, and I guess everybody knows how much I enjoy healthcare boards trying to regulate the practice of those not under their authority. This is a common issue we regularly deal with, apparently. I will commit, if this bill moves on to rules today, that reach out and convene several of the stakeholders if there needs to be changes to this bill. We would have both the option of doing that on the floor or sending that back to this committee to ultimately do those and have that conversation. I will say I spoke to the other 2 sponsors of the bills, and this issue has not been brought up to a single one of them prior to this committee today. So it feels a little interesting in that manner. But yes, should the chiropractic board be able to regulate what's under the chiropractors of this state, I firmly believe that's what it should be. And with that, Madam Chairman, I ask that we go ahead and move on and refer this to rules.
Sure. So Senator Lee has made a motion for a favorable report for the bill as amended, rolled into a new PCS, unfavorable to the original with a referral to rules. All in favor of that motion, please say aye. Anyone opposed? Motion carries. And we're going to move on to S600 Medicaid Agency Omnibus. Senator Bergen to present the bill. And I believe you have a amendment, Senator Bergen.
Yes, ma'am, Madam Chair, thank you. And if it'll be all right, I'll go ahead and explain the bill. The amendment is on the last section, and then we'll do the amendment and then explain that at the time, if that'll be okay.
Good plan. Thank you.
Thank you, Madam Chairman. Committee, this is the annual DHHS Medicaid Omnibus Bill. The provisions are moving through the House, and the first provision is included in the Senate budget. This bill does 4 things. First, it extends the temporary authority of the federally facilitated marketplace to North Carolina Medicaid eligibility determinations until June 30th, 2028. The temporary authority that we have right now expires on June 30th of this year. Medicaid eligibility determinations are otherwise made by county departments of social services, so this authority alleviates the burdens on those local offices. Second, the bill corrects language enacted in SL 2024-30-34 that specified that after incarceration, Medicaid beneficiaries would receive services first through North Carolina Medicaid Direct before enrolling in the PHPs or the preferred health plans. So it keeps them on fee-for-service for a year and then switches over to prepaid health plan. This change was an effort to streamline enrollment for the reentry population. This technical correction classifies that the justice population should be enrolled into the appropriate managed care plan on the first of the month following 365-day or a 12-month period after their release. So the 13th month, they would be moved over to the PHP plan. This section applies to, number one, inmates released on or after the date the act becomes law, or two, inmates released on or after January 1st, 2025, who are not enrolled with a PHP on the date this act becomes law. Third, the bill conforms to General Statute 108C-3 to reflect updated Medicaid provider screening requirements for federal regulations that took effect in 23 and 24. The conforming changes require heightened screening for skilled nursing facilities, portable x-ray suppliers, newly enrolling hospice organizations, and certain providers that received a waiver of fingerprinting requirements when they initially enrolled due to a national, state, or local emergency. So the amendment that I'm going to discuss at the appropriate time accepts feedback from the industry and it's approved by DHHS. So at this time, I will send forth the amendment.
Send forth your amendment and go ahead and present it when you're ready.
So what this amendment does, it adds language to clarify that if CMS returns like the skilled nursing facility category risk level to a lower one where it has previously been, that North Carolina Medicaid would not be stuck with the Medicaid requirement that is more restrictive than the federal requirements, while the North Carolina statute could once again be updated. So really it has to do with how all these folks are regulated, the information they have to provide, the risk categories that the different providers are in. And that's the amendment.
Thank you, Senator Bergen. And this is the DHHS bill, right? This is an agency bill.
This is an agency bill.
Seen all this and they've approved it, right?
Yes, ma'am.
Okay, thank you. Are there any questions about the amendment? All those in favor of the amendment, please say aye. Aye. Anyone opposed? Motion carries. We have one speaker signed up to speak. It is Jensen White from DHHS. I'm assuming that you're going to say that DHHS approves of the bill and please vote for it. Is that right?
Madam Chairman, I hope she puts her blessing on it.
Will you come bless the bill, please?
Thank you so much, and I just wanted to come say Senator Bergen did a great job of explaining the bill. This is the annual DHHS Medicaid agency bill, and as he mentioned, these provisions passed in House Health yesterday, and so we appreciate your support, and I'm happy to answer any questions now or after the meeting. Thank you.
Super, thank you. Does anybody on the committee have any questions about this agency bill? Seeing none, all those in favor, oh wait, we need a motion. Senator Robinson makes a motion for, oh, she's an advisory member. Sorry, that was my mistake. Senator Heiss makes a motion for a favorable report for the bill as amended, rolls into a new PCS, unfavorable to the original with a referral to rules. All in favor of Senator Heiss's motion, please say aye. Anyone opposed? Motion carries.
Thank you, Madam Chairman. Thank you, committee.
So, friends, I'm going to step over to the podium to present Bill 599, and Senator Sari will take over.
All right. Chair recognizes Senator Galey for Senate Bill 599.
Thank you. Mr. Chairman, this is a very simple bill. It's not complicated. It changes the way that members of the Board of Dental Examiners come to hold that position. Currently, the Board of Dental Examiners is elected by dentists statewide. This would change that structure so that they would be appointed through various routes. Some from the governor, some from the President Pro Tem, the Senate, some from the Speaker of the House. I do have two amendments. The first one is purely technical. If I could offer the technical amendment first.
Recognize to send forth your amendment.
So this amendment that I believe is before you is purely technical in nature and just corrects some typos in the bill.
All right. Any questions or comments on the technical amendment? Seeing none, we have a motion from Senator Heiss. All those in favor, please signify by saying aye. Any opposed? All right, the amendment is passed. Would you like to send forward your second amendment?
I'd like to go into the context of the bill, and then I'll like to consider the second amendment if that would please the chair.
That's great. Go ahead.
So currently, the Board of Dental Examiners is composed of 6 licensed dentists, 1 dental hygienist, and 1 consumer advocate. The dentists are elected by the licensed dentist, the dental hygienist is elected by the other dental hygienist, and the consumer advocate is appointed by the governor. This bill changes the makeup of the board. There would be 6 licensed dentists. 2 would be appointed by the governor, 2 would be appointed by the speaker, and 2 by the president pro tempore. The amendment, so in the original bill, we have a change in how the hygienists are appointed and how the consumer advocates are appointed. The amendment would have still 2 dental hygienists, would increase the number. The bill as before you would have 1 dental hygienist and 2 consumer advocates. We've all received quite a lot of emails from the dental hygienists saying that they don't, they think that they should have more representation on the Board of Dental Examiners. So the amendment would increase that to 2 dental hygienists who are licensed to practice dental hygiene in North Carolina. 1 would be appointed by the governor, and 1 would be appointed by the labor commissioner. And then instead of having 2 public consumer members, we would have 1 under the amendment, and that 1 public consumer member would still be appointed by the governor. So that is the nature of the amendment, Mr. Chairman.
All right.
And I have other comments on the bill. If we could consider the amendment and then have more comments on the substance of it.
All right, so we have a motion from Senator Galey with respect to amendment number 2 on Senate Bill 599. Any comments or discussion? Senator Adcock.
Thank you, Mr. Chair, and thank you, Senator Galey. I applaud you for wanting to add more representation to the board. What gives me concern is 1 public member. I think this board would be best served, since its mission, like all occupational licensing boards, their mission is public protection. I think they need more public voices there. So I would like to see more public members. And I realize we're trying to avoid an even-numbered board. You and I have talked about this and had good conversations about it. But I think we could work that out. I don't have any heartburn at all about 2 dental hygienists. Makes perfect sense. But I do have concern just about 1 public member. And I don't know what you can do about that at this point, but perhaps we could talk about that more moving forward.
Thank you, Senator Adcock. Senator Waddell.
Yes, I have a concern too. In as much as you are enlarging the board, you still give the governor only 1 appointment. Is that correct?
No, ma'am. I'm sorry.
You're recognized for a series of questions, Senator Galey.
Thank you, Mr. Chairman. No, ma'am. The governor still gets to appoint 2 dentists. It's the dentists are appointed 2 from the governor, 2 from the speaker, and 2 from the president pro tem. And the governor still gets to appoint one of the. I'm gonna ask the staff to explain the amendment because we talked about so many different things. Can you go through what the governor gets?
Sure. Jason, you're recognized.
Jason Moran Bates, Legislative Analysis. Under the amendment, the governor would appoint 2 dentists, 1 member of the public, and 1 dental hygienist. The General Assembly would appoint 4 dentists, 2 under the recommendation of the Speaker of the House, 2 under the recommendation of the President pro tem of the Senate, and the Commissioner of Labor would appoint 2 members, 1 dental hygienist and 1 member of the public.
All right, thank you for clarifying that. And the other thing is, why is it necessary to enlarge this board? Because you're starting off with a manageable board.
Senator Galey.
With the chairman's permission, if we could vote on the amendment first, and then I have more presentation about why the bill is necessary. If Senator Waddell would allow me the leeway to come back to that question.
All right, thank you.
See a motion from Senator Hayes to approve the amendment?
Quick question.
Quick question, okay.
Just to confirm that would be, and I guess to put it in different terms, as I'm understanding, it's a 9-member board. 5 would be appointed by the executive branch, 4 by the legislative branch, with 3 coming from the governor and 2 from the commissioner of labor. Is that
staff or Senator Gailey?
I'd defer to staff, if that's okay.
Jason Moran Bates, Legislative Analysis. I think what we end up with is a 10-member board. That's a dental hygienist and a member of the public from the governor. We have 4 dentists from the General Assembly, and I'm doing my math wrong here. Give me a second to look into that, please. Okay, so the governor would appoint 2 dentists, 1 dental hygienist, 1 member of the public. The General Assembly would appoint 2 dentists from the Speaker, 2 from the President Pro Tem, and the Commissioner of Labor would appoint 1 dental hygienist and 1 member of the public.
Any further questions or comments on the amendment?
So there's 2 members of the public on the board?
Staff.
Under the amendment, that is correct.
I think that's the confusion.
Under the amendment, it's 1 public member still. That's what I was.
Staff, Jason.
I'm sorry. So the amendment on page 3, line 33, rewrites the line to read 1 consumer member of the public. That's changing what the governor has in the bill, which is currently 2 members of the public, I believe. And then it's going to go, 1 of those members of the public is going to go to the Commissioner of Labor.
Any further questions or follow-up?
I'm sorry to do this.
What, I'll just remind the committee that we have 15 minutes and we do have some speakers signed up. But Senator Adcock.
So here's what I got. 6 dentists, 2 by the governor, 2 by the speaker, 2 by the pro tem. 2 hygienists, 1 by the governor, 1 by the commissioner of labor, 1 public member for 9 by the governor. And I would speak, and as I spoke to before, and maybe I'm out of order to speak to again, I really think we need to increase that public member by 1.
Thank you, Senator
Adcock. From staff that it also adds 1.
Senator Hayes, you're recognized for a comment.
Sorry, Mr. Chairman. It's my understanding from staff it also adds a public member to the Commissioner of Labor. So there's 2 public members for a 10-minute. Yes.
Senator Mayfield, you recognized.
Thank you. I think I'll just carry this thread of conversation. So A, we now have an even number on the board, which is, I think, always problematic. My guess is perhaps one of those that the governor's appointment for a public member maybe was going to come off and be replaced by the Department of Labor. And to Senator Heiss's point about executive versus legislative appointments, I think we just all need to remember that not all executive appointments are the same, and this body has taken great pains over the last few years to remove appointments from the governor and place them into other places that perhaps are more politically palatable. So it might be sufficient for constitutional purposes, but I do want to make the point that it is a fundamental difference about who gets that appointment.
Thank you, Senator Mayfield. Any further questions or comments about the amendment? Do we have a motion? Motion from Senator Hayes for approval of the amendment. All those in favor, please signify by saying aye. Any opposed? Our amendment carries. Senator Gailey, you're recognized to continue explaining the bill.
Thank you, Mr. Chairman. I would just come back to that last point to say that the purpose for the amendment is to increase the representation for the general hygienist. I understand that when you start talking about the details of 1 person here or 1 person there, and it gets complex and can be hard to follow along. But the underlying principle is that we've all received many emails on this bill, and including those from the dental hygienists who had concerns that they were underrepresented on it. So the purpose of the amendment is to address that concern from the dental hygienists so that they would know that they had been heard and that we had responded to those concerns. So we have heard concerns and addressed them. As far as the appointments and makeup of the board goes, I just cannot emphasize enough that this bill does not open the door for non-dentists to own or control dental practices. We have received dozens of emails from folks around the state claiming that this bill does things that it absolutely does not do. This bill continues with the law of North Carolina that only licensed dentists can own and operate dental practices. It does not do anything to change who can own, who can operate a dental practice. It does nothing to change the standard of care for dentistry or how the profession shall be managed internally. All it does is substitute appointments for elections. The majority of licensing boards in North Carolina operate through some form of hybrid process with appointments, including the medical board, North Carolina optometry, North Carolina podiatry, the opticians, the physical therapists, and the chiropractic board. If someone has concerns about a board that is not appointed, that is elected by its own membership, if you bring that to my attention, then I'm happy to work with you on bringing that into alignment with other medical professional and licensing boards in our state. Why is it important? Why is it important that our boards be appointed instead of elected? It's because when you have a closed profession, which is self-governing, it is inherently problematic for risk of self-dealing and self-protecting of the profession. As a lawyer, we've seen that multiple times, unfortunately, through the years, how lawyers can act in a way to exclude competition and try to keep the business for themselves. The LegalZoom controversy, I think, is a good example of that. The legal profession is, we have the checks and balances with the General Assembly, but also the legal profession, our rules of professional conduct are vetted and approved by the North Carolina Supreme Court. So it's not only the lawyers themselves and their elected representatives, there's a check on that authority and power of the North Carolina State Bar. We don't have anything like that for the dental board. We have a very small group of dentists in North Carolina who are absolutely empowered to make decisions that may, in some cases, be benefiting the profession more than the public at large. It's just inherently full of risk for people to emphasize their own commercial interests over the interests of the public. And I also think it's incredibly important when you have a state agency that is exercising the authority of the state, that those people have accountability to the public at large. And arguably the dentists who are self-electing of their own people, they are using the power of state to grant licenses to dentists, to remove or disallow license from dentists. They're using their power to discipline people. That is the power of the state of North Carolina. And because they're using the power of the state, there has to be accountability to people other than those that are just in the profession. And that is what we have now.
Thank you, Senator Galey. Just an announcement to the committee. So we have to be out of this room in 5 minutes. So the way I'm going to handle this is we have 3 speakers signed up for public comment. I'm going to ask for one of them, I think they know each other, to come and speak for a minute, and then I'm going to do 4 minutes of questions from the committee, and then we'll take a vote on it. So I believe Ms. Patel, Mr. Fetzer, Ms. Vick, if one of y'all would like to stand up, and Sergeant Arms, we'll do 1 minute for this final comment, if that's acceptable.
Good morning.
Thank you, Ms. Patel.
Good morning. Chairmans Galey, Sari, Bergen, and members of Congress, thank you for allowing me to speak to you this morning. My name is Sheetal Patel, and I am from Wilmington, North Carolina. I am also the widow of Dr. Henry Patel, who didn't die from an accident or an illness. He died in a dental chair. He died a preventable death. And I would like to give you a little bit of history on what happened. We were married for 27 years. He was a prominent cardiologist in Wilmington, served as chief of staff of New Hanover Hospital. And on July 30th, I accompanied him to a dental procedure that was supposed to take 15, 20 minutes max. My husband never consented to deep sedation or general anesthesia, yet that's what he was given. And the last time I saw my husband alive is when he walked through those doors to get a tooth put back on. 3 days later, he passed away. I'd like to tell you that why we need more representation on this board for consumer advocates is because of things like this happen and we don't know to ask any other questions. When my husband's body started convulsing, the oral surgeon and his team thought he was feeling pain instead of fighting for air, so they gave him more sedation. No one performed CPR in that office, and by the time EMS arrived, they worked on him for almost 30 minutes and still got his heart beating again. However, his brain never got oxygen during that entire time, and he passed away 3 days later, leaving me a widow at age 47 and our children fatherless at ages 21 and 19. I have decided to take this pain and turn it into purpose. And since then, I have become an advocate for patient safety in the dental setting. And I would like...
You can finish your comments. And I apologize, Ms. Patel.
Okay.
They're just going to run us out of here in a second.
Anyway, I'll skip to the part that I'm here to speak about, which is at the end of Governor Cooper's term, I received a letter from his office saying I was his choice and I was appointed as the patient consumer advocacy seat on the dental board. However, the dentist intervened and that position got taken away from me. I've yet to hear from anyone in the governor's office, but I have been advised that someone else was chosen. My only job here is to make sure that people know to ask the right questions, that our loved ones come out of a dental office alive. And I thought I would have made an excellent public advocacy person for this team. And that's why I'm here to ask that there be more consumer members to support our public and community's health.
Thank you, Ms. Patel.
Thank you.
All right, any comments from the committee? I'll take one comment, Senator Mayfield.
Thank you. So I hear all of those concerns and probably share those. I think what I want to address are the other concern that we've heard from constituents around this leading to the corporate practice of dentistry and things like that. And I hear you, Senator Galey, that this bill doesn't do that. What this bill does do, however, is open this board up to political appointees that perhaps might be more inclined to change the rules at the dental board, which are now very protective against the corporate practice of dentistry, which if we're talking about public accountability and patient safety, is absolutely what we want to do. We want to keep that prohibition in place in North Carolina and not allow non-practicing physicians and dentists to be dictating what happens in the dentist chair.
Thank you, Senator Mayfield. Senator Lee.
Henry was my friend, and Cheadle is my friend. This has nothing to do with DSOs. This has everything to do with how the dental board moved forward after Henry died. And the protectionism that goes on is real. And I really appreciate y'all bringing this bill forward. I think it's needed. I would also support an additional personal or non-professional consumer member on the board. But this is something that really does need to happen, and it has absolutely zero to do with DSOs. Thank you.
Thank you, Senator Lee. Is there a motion from the committee? I see a motion from Senator Hayes. All those in favor, please signify by saying aye. Aye. All opposed, signify by saying likewise. And Senator Hayes, I'll clarify that is a motion for a favorable report for the bill as amended or rolled into a new PCS, unfavorable to the original with referral to rules. Is that correct? All right, this meeting's adjourned.